Travel kit. It is really important to be prepared for any emergency while traveling. So, a travel kit should be kept ready for a person with diabetes. Before you start to travel, visit your doctor for a checkup to ensure you are fit for the trip. Make sure to ask your doctor how your planned activities could affect your diabetes and what to do about it. How to adjust your insulin doses if you are traveling to places in different time zones. Now, what exactly should a travel kit consist of? Glucometer ideally should be with you at all times. Even if you are just going to a grocery store, it is especially important to check and double check that you have yours before you leave for the airport or set out on an extended road trip. Oral diabetic medications. Pack your tablets so you don't miss a dose. Insulin pump. If you are using an insulin pump to regulate your blood sugar levels, make sure you bring it with you. Extra battery for the meter and insulin pump if you are using one. Glucose meter batteries differ by manufacturer. Make sure you know which type you need and keep spares in your testing kit. Insulin. If you are going to a hot climate, pack an insulated bag with cold packs to keep your insulin cool. Syringes or any other insulin devices. Calculate the syringes or the insulin doses as per your stay and always carry extra. The test strips. Always keep an ample supply of test strips with you in case you need to test more frequently than you anticipated. The lancing device and lancets. Carry at least the number of lancets needed for an entire day of testing. It is preferable not to reuse a lancet since it is no longer sterile after a single use and is more dull, which increases the discomfort. Ketone strips. Even if you are rarely using them, these are good to always have on hand. Foil wrapped strips last longer. Glucagon Emergency Kit. Glucagon is used in emergencies when blood sugar drops so low that you're unconscious or can't even swallow. Learn how to use it. Teach those closest to you how and when to use it, and don't leave home without it. Fast acting glucose. You should always carry a small supply of fast acting glucose with you at all times in case you have low blood sugar reaction. Glucose tablets are available for the specific purposes. You can keep these in your purse, coat pocket, briefcases or glucose testing kit. Snacks are useful for raising your blood sugars if your sugars are low, so do carry some. Medical identification. It is good idea to wear some sort of identification, be it card or a paper with the written details that indicates to emergency personnel that you have diabetes. If you are in an accident or found unconscious, this alerts the medical responders to address your diabetes needs immediately. Health history. For more extensive travel, it's wise to carry a copy of your health history with you. A basic history includes known conditions including type 1 diabetes, allergies, medications you are taking including any vitamins and herbal supplements, emergency contacts, information, health providers and their contact information. Update this information at least once a year. So, these are some basic travel requirements. Pack this and you are all good to go.